There is a particular kind of courage that has nothing to do with danger. Not the courage of the battlefield or the burning building. Not the courage that produces medals and citations and the formal acknowledgement of institutions. The quieter kind. The courage of walking into a room where someone is suffering and choosing to stay not because you have a solution, not because you have been trained for this, not because staying is required of you by any professional obligation or social expectation, simply because the person in the room is a person, and persons in rooms like this deserve to have someone stay. Robin Williams had this courage in a form that most people who knew him publicly would not have predicted from the public version of him. The public version was velocity and volume, and the particular kind of generosity that fills a room by filling it with laughter. But the courage that brought him into a room and kept him there was a different thing entirely. It was stillness. It was the capacity to be with someone in the specific darkness of their situation without immediately trying to illuminate it, without reaching for the performance that had always been available to him as a way of managing the unbearable. He walked into rooms, and he stayed in them. This is the story of one afternoon in 1993, in a hospital in San Francisco, when Robin Williams walked into a room and stayed for 2 hours, and nothing that happened in those 2 hours was recorded or photographed or witnessed by anyone except the 2 people in the room, and what the patient said afterward, and what the doctors noticed, and what it might mean that a man who made the world laugh understood, more completely than most people ever do, the difference between making someone laugh and actually being present with them. The volunteer visitor program at the hospital had been running for 3 years by 1993. A coordinator, a list of approved volunteers, a protocol developed with medical staff to protect patient welfare while allowing the human connection that the medical literature was beginning to take seriously as a factor in patient outcomes. The protocol was clear. Volunteers greeted patients in common areas or doorways, offered brief conversation, provided company without intruding on medical care or patient privacy. The interactions were typically short, 15 minutes, perhaps 30. The coordinator, a woman named Patricia Voss, had been running the program since its inception. She had developed a practical wisdom about what worked and what didn't, about the difference between people who visited hospitals to feel good about themselves and people who visited because the patients needed something and they had it to give. When Robin Williams was brought to her attention as a potential volunteer through a connection Patricia Voss has described as indirect and informal, she had the caution of a person who had learned to be careful about celebrity volunteers. Their presence sometimes generated excitement that was not appropriate to the medical environment. He came on a Tuesday afternoon in the late spring of 1993. He arrived without an entourage, without a publicist, without the machinery that accompanied most public figures in most public contexts. She met him at the entrance. She explained the protocol. He listened. He asked 2 questions, not about logistics, not about the schedule, but about the patients. What were they dealing with? What did they usually need most? Patricia Voss answered both questions. Then she said, "I'm going to take you to the corridor, and we'll see how it goes." He nodded. They walked into the hospital. The corridor visit lasted approximately 20 minutes and proceeded in roughly the way that Patricia Voss had anticipated. Robin Williams spoke with patients and family members who happened to be in the common areas, brief, warm exchanges, the kind that made people smile and forget for a moment where they were. He was not performing, or not performing in the theatrical sense, but he was doing what he always did in rooms full of people, making himself available, directing his attention outward, using his gift to create a particular quality of ease in a space that usually held very little of it. Patricia Voss watched him work and made the assessment she always made of new volunteers. He was good at the corridor. The question was whether he understood that the corridor was the boundary, that what lay behind the numbered doors on either side of the corridor was different territory governed by different rules. She was about to suggest that they wrap up the visit when Robin Williams stopped outside room 14. He had not been told anything specific about room 14. The door was slightly ajar. Through the gap, not much was visible, the edge of a bed, a window with afternoon light. But he had heard something. Not a voice exactly, the absence of voice. The specific quality of silence that a room holds when the person inside it is awake and alone, and has been awake and alone for long enough that the silence has become a texture. He looked at the door. He looked at Patricia Voss. "Can I go in?" he asked. Patricia Voss hesitated. Room 14 was not on the schedule. The patient in room 14 had not been flagged as someone the program was working with. She knew the case. She knew most of the cases on the ward, and she knew that the situation in room 14 was serious. "I'll check," she said. She went to the nurse's station. She came back 2 minutes later. "He said yes," she told Robin Williams. "But I want you to understand this isn't a corridor situation. He's been here for 3 weeks. He's not doing well. You don't have to go in, and if you go in, you can come out whenever you need to." Robin Williams looked at the door. "Okay," he said. He went in. Patricia Voss did not follow him. She waited in the corridor. The patient in room 14 was a man named Gerald Watts. He was 54 years old. He was a retired high school history teacher from a suburb south of San Francisco who had been admitted to the hospital 3 weeks earlier with a diagnosis that had subsequently been revised in a direction that was not encouraging. He had a daughter in Portland who visited on weekends. He had a sister in San Jose. He had, on the afternoon of the Tuesday in question, been alone since morning. What passed between Robin Williams and Gerald Watts in the 2 hours that followed is known, in its specific content, only from Gerald Watts's own account, given first to his daughter, then to his sister, then to his doctor, then to Patricia Voss, and finally, years later, in a conversation with a journalist who was researching a piece on hospital volunteer programs that was never published, but whose notes have been shared with limited permission. The accounts are consistent in their essential shape, and they converge on a description, not of what was said. Gerald Watts was specific and consistent in his refusal to detail the content of the 2 hours, but of what the 2 hours were like. Robin Williams sat down, not on the visitor's chair by the door, which was the expected position, the chair that maintained the appropriate distance between the visitor and the patient. He pulled the chair close to the bed and sat in it the way someone sits in a chair when they are not planning to leave soon. He did not begin with humor. He did not perform. He asked Gerald Watts a question. Gerald has reported the question as, "What's the worst part?" and has said that it was asked in a tone that made clear he was prepared to receive whatever the answer was, that he was not asking in order to then fix or manage or redirect the answer, but simply because he wanted to know. Gerald Watts answered. He talked for a long time about the diagnosis and about the fear and about the specific, grinding quality of 3 weeks in the same room, and about his daughter, and about the history classes he would not be teaching anymore, and about the particular grief of a man who has always been the person other people came to, and who now needed someone to come to him and had found that need difficult to communicate and difficult to have met. Robin Williams listened. He listened with the quality of attention that Gerald Watts later described, in each of his accounts, as different from any listening he had experienced before. Not because it was more attentive in the technical sense of being more focused or more responsive, but because it was more still. There was a quality of stillness in Robin Williams' listening that Gerald Watts, a man who had spent 30 years in classrooms and understood something about the difference between genuine attention and performed attention, recognized immediately as the real thing. He was not preparing a response. He was not managing the conversation. He was not performing empathy. He was simply in the room, with the person in the room, receiving what the person in the room was giving him. And at some point, Gerald Watts does not remember when, precisely, during the 2 hours Robin Williams made him laugh. Not with a prepared bit, not with the specific high-velocity improvisational humor that was his public signature. with something much smaller, an observation about something in the room, something specific to the texture of that particular afternoon in that particular hospital room, an observation that was funny in the way that true observations are sometimes funny, because they name exactly the thing that has been present and unnamed, and the naming of it produces the specific relief of recognition. Gerald Watts laughed. He said, in his account, that he had not laughed in 3 weeks, not because nothing had been attempted. His daughter tried, his sister tried, the nurses were kind, but because the laughter that had been offered to him had been offered as medicine, as something designed to make him feel better, and he had been able to feel the design in it, and the design had made it impossible to receive. The laugh Robin Williams produced in that room was not medicine. It was the laugh that occurs between two people who are genuinely in the same room, seeing the same thing at the same time, finding it funny together without either of them trying to make the other person feel better. Gerald Watts has said, in every account he has given, that this is the distinction that mattered. Not that Robin Williams was funnier than other people, though he was, but that the laugh came from the two of them being genuinely present together, rather than from one of them trying to give the other something. Patricia Voss waited in the corridor for 2 hours. She was not concerned, exactly, but she was attentive in the way that she was always attentive when a volunteer was in a room with a patient whose situation was serious. She checked in with the nurse's station twice. She was told that everything seemed fine. She waited. At the end of the 2 hours, the door to room 14 opened and Robin Williams came out. Patricia Voss looked at him. He looked different from when he had gone in. Not distressed. She had seen volunteers come out of difficult rooms in distress, and this was not that. He looked, she has said, like a person who has been somewhere that required something real of them and has given it, and is now returning to the ordinary corridor, carrying the weight of having been there. He did not say much. He asked about Gerald Watts, whether there was anything the program could do, whether he could come back. Patricia Voss said she would look into it. He nodded. He thanked her for the afternoon and for the program. He left the way he had arrived, quietly, without the machinery, without announcement. Patricia Voss went to the nurse's station and made a note in the program's records. The note was factual and brief. It recorded the date, the ward, the patient's room number, the duration of the visit, and a single observation. Volunteer remained with patient for 2 hours at patient's request. What it did not record, because she did not know it yet, was what the nursing staff would observe in the days that followed. Gerald Watts's doctor, a physician named Dr. Raymond Cho, who had been managing his care since admission, noticed a change in his patient in the week after the Tuesday visit. The change was not in the clinical metrics. The diagnosis remained what it was. The prognosis was not altered by what had happened in room 14 on a Tuesday afternoon. The change was in Gerald Watts himself, in his engagement with the ward, with the nursing staff, with the treatment, in his willingness to eat, to participate in the physical therapy that had previously been met with minimal cooperation, in the quality of his presence in the room, the specific quality that Dr. Cho, a clinician who was careful with language, described in his notes as increased affect and improved engagement. Dr. Cho asked Gerald Watts, during his next clinical review, whether anything had changed. Gerald Watts told him about the Tuesday visit. He did not name the visitor. He did not think it was relevant to the clinical conversation, and he was also, he said later, protective of the privacy of what had happened. He described as best he could what the 2 hours had been like. Dr. Cho listened to this account and added to his notes, patient reports, meaningful human connection on date, patient attributes improved engagement to this contact. The note was clinical and measured. What Dr. Cho said to a colleague afterward, in a conversation that found its way through several degrees of connection to Patricia Voss's account, was less clinical. I've been watching this patient for 3 weeks. He was withdrawing. After Tuesday he came back. I don't know what happened in that room. I know it mattered. Gerald Watts was discharged from the hospital 14 days after the Tuesday visit. Not because the prognosis had improved, but because his engagement with treatment had improved sufficiently, that continued inpatient care was no longer the most appropriate option. He went home to his house south of San Francisco. His daughter came from Portland. His sister came from San Jose. He lived for another 14 months. He did not speak publicly about the Tuesday visit during those 14 months. He mentioned it to his daughter and his sister and his doctor, and to Patricia Voss, each time in terms that were consistent with each other, and consistent with his characteristic refusal to name the visitor or to detail the content of the 2 hours. What he said consistently in each of these conversations was this: "That man listened to me, really listened, not to make me feel better, not to fix anything. He listened because he wanted to know what it was actually like. And then he made me laugh, not because he was trying to make me laugh, but because we both saw the same thing at the same time and it was funny, and I hadn't laughed in 3 weeks. And after I laughed, I felt like myself again, not like a patient, like myself." He paused when he said this, in Patricia Voss's account, which is the most detailed of the accounts that survive. "That's a very rare thing," he said. "Being made to feel like yourself, by someone who has absolutely no obligation to do it and nothing to gain from it." Patricia Voss continued running the volunteer program for another 7 years, until her retirement in 2000. She has spoken about the Tuesday visit in the careful way of someone who is protecting 2 things simultaneously: the privacy of the patient, who requested it, and the privacy of the volunteer, who requested nothing, but whose request for quietness was itself a form of instruction. She has confirmed the basic facts of the account: the date, the ward, the duration, the nature of what the nursing staff observed. She has not confirmed the identity of the volunteer in any statement intended for public record, though the specific combination of details she has confirmed is sufficient for those who have researched the question to leave little uncertainty. "What I can tell you," she has said, in one of the few conversations she has given on the subject, "is that in 7 years of running that program, I never had a volunteer stay in a room for 2 hours. The protocol was 15 minutes, 30 at the outside. He didn't ask about the protocol once he was in that room. He just stayed as long as he was needed." She paused. "And when he came out, he asked if he could come back. He did not come back. His schedule, the production demands of a working career, the particular logistics of a life organized around performance and travel, these things made a return visit to a Tuesday afternoon volunteer program in San Francisco the kind of intention that does not survive the machinery of a demanding professional life." Patricia Voss understood this. She did not hold it against him. What he gave in the room, she said, was enough, more than enough. It was everything the program was designed to produce. He just produced it differently than anyone else did. The nursing staff member who spent the most time with Gerald Watts in the 14 days between the Tuesday visit and his discharge was a nurse named Lisa Tran, who had been on that ward for 4 years. She has spoken about the change she observed in Gerald Watts in the week after Tuesday, in the specific, careful language of someone who has been trained to be precise about observation. "He started talking more," she said. "Not because anything had changed clinically, because he wanted to. He told me about his history classes, about a particular unit on the Civil War that he had taught every year for 27 years, and that he was very proud of. He told me about his daughter. He told me about a fishing trip he had taken with his father in 1962. None of this had anything to do with his treatment. It was just him, being himself, wanting to be known." She paused. "I've been a nurse for a long time. I've seen patients withdraw, and I've seen patients re-engage. I know the difference." He re-engaged. Something happened on that Tuesday that made him want to be known again. And when a person wants to be known, they're still fighting. They're still here. Gerald Watts was still here for 14 months. His daughter was with him at the end. So was his sister. He died in the house south of San Francisco where he had lived for 22 years, in the specific comfort of a person who has been known, who has been listened to, who has been made to feel like himself, who has laughed when laughing was the last thing anyone expected, and the only thing that was needed. He did not know the name of the person who had sat in the chair by his bed for 2 hours on a Tuesday in 1993. He did not know, or did not acknowledge knowing, that the person was famous. He described the visitor, to his daughter, as a man who knew how to be in a room with someone. His daughter did not know, at the time, what to make of this description. She has thought about it for 30 years. She thinks she knows what it means now. It means that her father, in the last 14 months of his life, had been given the specific gift of being seen not as a patient, not as a case, not as a man with a diagnosis that was moving in a direction that everyone in the room understood and no one said out loud, but as a person. A retired history teacher who had a daughter in Portland and a unit on the Civil War, and a fishing trip in 1962 and 30 years, of students whose names he still remembered, and a laugh that had been dormant for 3 weeks and was returned to him on a Tuesday afternoon by a man who knew how to be in a room with someone. That is the whole story. A man walked into a room. He sat down. He asked what the worst part was. He listened. He made someone laugh. He stayed for 2 hours. He left quietly. He asked if he could come back. He could not. What he left in the room was enough. It is always enough when the thing that is given is the real thing, the actual presence, the genuine attention, the laugh that comes from two people seeing the same thing at the same time and finding it funny together, the specific human gift of being with someone in their room without needing them to be different than they are, or the room to be different than it is. Robin Williams gave this gift many times. He gave it without cameras. He gave it without credit. He gave it because a man named Gerald Watts was alone in a room and the silence had become a texture and someone needed to come in and stay. And he stayed.